Thank you, Speaker. My question is for the Acting Premier. Frontline mental health care and addiction workers are feeling and struggling with an increasing burden every day in this province. In many places in Ontario, many of those struggling with mental health and addictions don't know where to go for help. In my riding in Nipissing, some head to the Nipissing District Social Service Board office, which is in City Hall in North Bay. One man showed up there last week and promptly collapsed in the hall, unresponsive. EMS was called and he was rushed to the hospital. You can imagine how traumatic this is for the staff and for clients who are present at the same time. After 15 years, Speaker, we shouldn't be at this point. To the Acting Premier,
question.
I ask, is this really the legacy the Liberals want to leave?
Thank you. Acting Premier.
To the Minister of Health and Long-Term Care.
Minister of Health, Long-Term Care.
Thank you very much, Mr. Speaker. And of course, we have increased our investments in mental health and addictions dramatically through all the years that we have been involved in government. And of course, our investment in the 2018 budget is a historic investment of some $2.1 billion. Amazing. It's the largest investment in Canadian history in mental health and addiction services. Now, we don't know much about the PC's plan, but we do know that the leader of the official opposition has said that he is going to cut funding for supervised injection sites. Yep. This is obviously an addiction issue. We know that these harm reduction sites provide wraparound services for some of our most vulnerable people, supports that are saving hundreds of lives. Yeah. So, before the member opposite questions our budget, I'd like to hear a little bit more about what they are considering to do about mental health addictions other than cutting the budget.
Thank you.
Mr.
Supplementary.
Back to the Acting Premier. The opioid crisis is well documented, and deaths continue to rise to all-time highs in Ontario, more than 1,000 people last year alone. In the Northeast Lynn, which encompasses my riding of Nipissing, opioid abuse cases and mental health disorders are double the provincial average. The CAO of the Nipissing District Social Services Board believes the local situation is in crisis. The board chair says, quote, "Too many vulnerable people in our district are suffering needlessly." They are asking our Northeast Lynn to establish and help lead a district crisis task force. Speaker, to the Acting Premier, will the Minister of Health direct the Northeast Lynn to work with our local officials and take action on this finally?
Thank you. Minister.
Mr. Speaker, I'm having real difficulty reconciling the question from the member opposite with his leader's comments most recently this last week. Of course, we've been extremely conscious of the opioid crisis, and this is why we're investing $222 million over 3 years to combat the opioid crisis. And of course, part of our strategy has been expanding harm reduction services, hiring more frontline staff and improving access to addiction supports across the province. So now we have made naloxone kits available to pharmacies, public health units and police and fire services, and we're now making an easy-to-use nasal spray available. Mr. Speaker, we are doing everything that we possibly can to combat this public health crisis. We will continue to do so, and I will take no lessons from the member opposite on this file.